Thank you, Professor Holmfeld. Thank you, Diana, and thank you all for being here today. It's a special occasion to talk about this very serious theme and to give amplitude to this question. I believe we need to get very serious about this torturing condition for a human being. But before I start my presentation, I want to start with two good news that through the efforts of many of you, and including Diana and other people, including myself, we were able to involve WHO in the building up of a document, which is a crucial document. It is a landscape document on how and how to establish a crisis line, which means the recognition of WHO of the importance of volunteers and helpers through telecommunication, chat rooms, and other for the prevention of suicide. The document is dated 18, but actually came into free distribution at the beginning of this year, so it's a very timely event. And the other communication concerns this association that tries to put together several entities in a cooperative way and in order to exchange information, maybe give some rules or basic rules to the management of helplines, and particularly those devoted to the prevention of suicide. This entity is called WATCH, World Alliance of Crisis Helplines, and it has been a difficult starting, but with many different ideas. But we are there now, and the publication of this WHO document is an important milestone for the aggregation of people around this concept. Okay, loneliness. Loneliness, which is different from solitude, different from solitariness, different from living alone, different from being physically isolated. As such, is an entity that requires a standardized definition, and not much research in proper terms has been dedicated to this concept of feeling lonely. Loneliness is a very common feeling. Everybody, sooner or later during life, may feel distressed by feeling lonely. There was a very nice professor who dedicated his life to the study of loneliness. His name is John Cacioppo. Unfortunately, he died last year after having dedicated more than 30 years to the study of loneliness. And his definition of loneliness is the one that is circulating more widely around the globe. And having a common definition is really important to share impression, to share knowledge, and to do good research. Otherwise, we may get confused. You're lonely if you feel lonely. You're lonely when you feel that you're not understood by the other. So it's a very subjective sensation and has a special quality, that is being maybe in a crowded environment, nevertheless feeling apart, feeling not known by the others, feeling not understood by the others. And there are several conditions. This is Giscard Cohen-Mansfield that has produced this list of factors that may contribute to loneliness. Environmental circumstances, lack of opportunity to meet people, superficial contacts, peculiar lifestyle habits, or even financial difficulties. And of course, physical problems, mobility difficulties, and other physical limitations also due to the environment. Psychological aspects, such as your personality, inadequate social competence, or reliance on your spouse that is unfortunately not any longer with you, all of that may create serious problems at the loneliness level, which may cause in turn anxiety, feeling of detachment, of not being part of anything, silent suffering, fear, depression, and suicidality, which is the main topic of my speech of today. But you have heard already since yesterday and before probably that loneliness has been recognized as the cause of many serious physical problems, including premortality and predisposing dementia, and having consequences similar to risk factor like smoking regularly, 15 cigarettes a day, or being frankly obese. To the point that the American Surgeon General at the beginning of last year came out with a news press article titled "Loneliness Kills." And all of you may know that there are serious reasons for being more concerned about the phenomenon of loneliness, because not many families are being created any longer, not many births are there, and the world is getting older and people are aging more and more. So the possibilities are less for feeling together with other people. And after the publication of a number of very serious reports, Theresa May last year appointed a minister, Tracy Crouch, for loneliness. The minister changed after a while then. And some of these reports concern, for example, the extreme degrees of loneliness felt by people being caregiver of disabled people. And the problem of caregiving, for example, an Alzheimer's patient from a family member being maybe the only caregiver, it's very serious, to the point that these caregivers may incur in serious suicidal syndromes, and some of them dying by suicide. These are a couple of studies made by my institute in Australia. This was the first one. This is on a wider scale, including 566 caregivers, and noticing that suicidality is unfortunately a common outcome of this degree of assistance to demented patients. Some are also homicidal, and in a country like Italy, from the beginning of this year, 19, there were 22 cases of homicide suicides involving carers of Alzheimer or demented patients and their caregivers. So the caregiver killed the patient and then died by suicide. 22 cases are an unprecedented dimension for a country like Italy. Loneliness has been reported as an ubiquitous problem, and this is another important public announcement by Arthur Brooks, the president of the American Enterprise Institute, that say that loneliness is killing the Americans, and he quoted the tremendous increase in the number of suicide in the country. Please have in mind that America is probably the country that invests more in suicide prevention, but is the only Western country in which there is a constant increase in rates of suicide, an increase that has reached 30% in the last 22 years. So a big problem. 45,000 deaths by suicide in 2017, plus a number of other probably undetermined or poorly determined deaths. And this is a map of the interest towards loneliness. It's a very recent map indicating that at least 20 countries have already answered by national reports on the status of their nations with concern to loneliness. So is a major problem, and this conference today is very timely conference because we have to deal with a phenomenon that is creating serious concern in many, many countries. We have to ask ourselves who are the most affected. Probably the answer, demographically speaking, would be quite easy. Women do live longer, so apparently they should be more exposed to feeling of loneliness. But women are even more open towards declaring, confessing their loneliness. Men are more reluctant because they feel the stigma. And there are feeling rules which are quite widespread. There is a kind of cultural script. Men don't cry, men don't have to show their weaknesses, so they are not very open towards their feeling of loneliness. But if you ask them indirectly, for example, throughout a questionnaire, you may witness that men are more suffering from loneliness than women. This is still an unpublished paper, just being produced. It's a research on the general population in Slovenia out of a sample of 1,200 individuals aged 18 up to 95 with a simple scale. And we can see with the double circle that loneliness increases with age, but is more marked, the score is higher in men than in women. So men seem to suffer more, especially if they are asked indirectly through a questionnaire, so they don't have to show their suffering and don't feel shame in declaring something. So it's a problem. It's a problem that causes many situations. Depression is directly related to loneliness, so there is a causal direct correlation between loneliness and depression. The reverse is not true, apparently, so it's not been demonstrated that depression causes or is related significantly to loneliness, but loneliness also concerns an extreme situation, probably the worst of all human tragedies, which is suicide. And I must admit that research is just initial in this area. So we know clearly that men that die by suicide must feel terribly lonely, but loneliness as such has yet to attract attention from researchers. We have been targeting for many years depression and other conditions of psychiatric relevance, but loneliness has remained quite neglected in the landscape of causal factors. So particularly when people lose someone who is dear and near to them, their spouse, their partner, for example, and particularly if they have some age, a new project is very difficult. So reinventing life can be a very, very difficult enterprise. And in fact, there are studies that demonstrate that after the loss of partner, particularly men are much more exposed to suicide. There is an 8-time increase in suicidal risk in the older men in the first year after the death of the spouse. This is a very quoted Danish study based on the famous Danish National Health Register. And elderly women seem to be a bit less affected than men by that. And then, with the time, the risk decreases. But for many, it remains very high, even in 3 years after the death. And loneliness, this is Conversation, a very nice academic paper which is free for all of those who want to be in contact and is contributed by scholars throughout the world. Deadly loneliness. This is a study from my institute in Australia, and it's quite an illustrative study because through the psychological autopsy investigation, you try to reconstruct what happened to the individual before they died, what brought them to death, to this tragic decision. And you can see here is a controlled study through elderly but also younger individuals, suicide, but also sudden death as a control, sudden death, accident, or a stroke, or myocardial infarction, other sudden deaths. And you can see that the people who died by suicide, which are the highest columns, I don't know if I can show it to you, but anyway, wrong. The columns which are higher, they correspond to the feeling of not having received, not the practical help, the concrete help, not the money or the goods, but the emotional help. So they suffered tremendously, and much more than the people who died by sudden death, because they were not receiving what they needed, both by friends and their families. So the emotional support, feeling not alone, it's of crucial importance for those people who died by suicide. And these are men, only men. And in fact, another study through the Slovenian Institute, an as-if study, a simulation study, based on the shuttle data bank represented by the European Social Survey. Everybody may consult it. But it shows, if you look at the two lines, if we were able to provide social support, emotional support to men, the rate of suicide may be able to decrease 3 times. So the rate of suicide in men may decrease enormously, just adding efficient social support. If you do the same with women, which is the lower line, virtually nothing changes, because women are already well supported. And what causes suicide for them is probably different than what causes suicide for men. This is very important, and clearly, indirectly, points out to the enormous importance of support. I was telling you that loneliness has entered the suicide research arena quite recently, and still very softly. These are a series very rapidly of new studies on this topic that shows how important is loneliness. For example, these are college students, so a much younger population, in anticipating or promoting suicidality, suicide ideation. This is instead a study run in the general population of the region of Spain, and the study indicates that loneliness is an important risk factor for suicide ideation in older adults. But also this study is important, and I underlined it's important, because we are still used to ask people, do you live alone? We should instead ask, do you feel alone? Which is much more important than the demographic element of our anamnesis. And here we are in China, claiming the importance to implement an assessment also in psychological study based on loneliness. And the UCLA scale, which is probably one of the 2 most famous scales to detect loneliness, is probably much needed to assess also this variable in individuals in China too. But on the other hand, we try to create theories to refer to the main interpretation of phenomena, and clearly suicide, it's one of those phenomena that has attracted many theories, many different theories. with their cultural origin being now and then different, orientated culturally in a specific way. This is a psychological theory called the interpersonal theory of suicide, which is probably the most quoted at the moment, and is based on two principles. One is called thwarted belongingness. People don't feel they belong to. And the other is perceived burdensomeness. So feeling a burden to other people, to their family members, to their children, to other people, to partner. And these are the two basic concepts. Then familiarity with pain and availability of the means are elements that may bring then to suicide. And these are another number of studies that have identified the importance of support for people, and support important in a protective way against suicide, and social support considered to be an important element for connecting and saving lives. However, the point which is difficult to solve for us, aimed at saving lives, is what sort of contact can we provide to people? Can we simply add contacts? Can we simply be in contact? Or it would be more important the quality of these relationships? And certainly the quality makes the difference, is the important factor, as clearly underlined by this recent study. And this represents a problem, because to create quality relationships, we need a cultural shift. We need to implement a new culture about the importance of relationship, and probably not simply to support people adding artificial or formal company to people, which is probably better than nothing, but probably is not the best solution. So the theory of the quality connection is extremely important, because quality connection may bring to individuals feeling that they belong to society, to their community, that they really belong to something. So creating this personal value social network has been pointed out as one of the main principal elements to save lives. I'm sure that the speaker that will follow will be more precise, but I need to pinpoint a few elements through the role of social media for what concerns loneliness and suicide. You know, we have many advantages. Internet has radically changed our life, and in a way so rapid and unpredictable that is really difficult to foresee the futures of tomorrow. But Internet, for sure, has been involved in amplifying a few suicide-related phenomena. For example, Internet involves risks like diffusing the contagion or imitations with regard to suicide, sharing information on new suicide methods. The charcoal burning, for example, in Asia has been one of such examples. Helium gas inhaling has been another elements of diffusion through the web of a new suicide method. Undertaking suicidal behavior can be pushed through the internet, and normalizing suicidal behavior as an acceptable form of coping mechanism is another thing that has been clearly popularized through the internet. For sure, there has been an enormous increase in self-injurious behavior, and this has been solicited by the many websites that encourage this element. We count at least 8,000 websites through the world that are related to self-injury. And people go to this website to exchange in real time what they are doing to themselves, to their bodies, cutting, burning, kicking, and they do it with their camera and sharing this information, this sensation, and this didn't happen before. But the phenomenon is so concerning, and this is again the conversation that says a lot has changed, particularly for the very young individuals in the last few years, and probably what has happened in the United States, this tremendous increase in suicide of girls that nearly parallels the one of boys. It's a new phenomenon, and it has been particularly alarming. And this cannot be unrelated to the internet diffusion. So we have many advantages through social media and the connection opportunities, but clearly is a kind of double-edged sword. So there are advantages, but we need to pay attention also to disadvantages. And clearly loneliness may play a big element in that, because it can be very difficult to have new friendships, especially if you withdraw completely from real life, especially if you spend all your time in your room interacting through the internet. So this cannot be a solution for loneliness. And I don't know if you are aware, but yesterday it has been reminded to those attending the presentation. Last year we created in Italy a national day to fight loneliness, which has been indicated on 15th of November. And we had the first national conference. It was the Italian Association of Psychogeriatrics that took the initiative, and this is the poster. It was held in Padua, and it will be replicated this year in the beautiful Florence on the same date. So 15th of November is something to remember how important is loneliness, particularly for elderly individuals. Thank you for your attention.